the announcement by Coopervision that Sarah Michelle Gellar has partnered with Coopervision to basically take on myopia control. And I thought that this was a really interesting move. One, because as I've mentioned lots on this podcast, when I talk about Ortho-K out in the real world, most people say, I've never heard of this, and why have I never heard of this? And I think a big part of that reason is we don't have that kind of, foundational or spotlight attention that I think comes with partnering with somebody that people would listen to, like a celebrity. My question is Sarah Michelle Gellar the right person for this job? Who is the right person for this job? And is this a good move? Is this a bad move? What does this mean for industry? And we'll start with Paul. Paul, what do you think about Buffy the Vampire Slayer being a spokesperson for myopia control?
Oh, I mean, I should start off by saying I never really watched Buffy the Vampire Slayer, but I know her name. Like when you say her name, it means something to me. I just don't know exactly what it means, but I know like, oh, that's a famous person. So I think that having a famous person standing up for myopia, and what Coopervision is trying to accomplish, I think is a good thing. I don't think, we're going to see her, in a boxing match against Greg Brady on, some random cable network channel. Like she's a real celebrity. And so I think it's great. I mean, I think it's awesome. I think Coopervision has really stepped up to the plate big time. They see the value in myopia management. They understand what's at stake, and they need to get to the doctors, but they really need to get to the public, because without the public pressure, then not enough doctors are going to adopt this modality to their practices. And so I think going this kind of celebrity route is a great way to get to the people, and then the people will come back to us. So I have to super commend Coopervision. Is she the right person? I have no idea. I don't even know what the right person looks like. I don't know what that is, but anybody that can lend their name and any kind of credibility to what we are trying to do, I think is a really, really good thing.
Yeah, Cheryl, would you agree that, one of the best ways to convince a doctor that myopia control is something that they should take seriously for their practice is to actually go to the patient and have the patient say, why aren't you doing this?
I think that you have a certain number of doctors who just get super excited about myopia control, and they're going to kind of grab the bull by the horns no matter what. But I do think that there's a fair number of doctors, and probably a larger number of doctors, who need some other incentive. Because let's be honest, incorporating myopia management into your practice, at least right now, it takes effort. Anytime we do something that isn't our normal protocol, it takes effort to incorporate that. And especially now, I mean, with 2020 and coronavirus, everybody's focus just shifted over to that. And so we really need to draw that focus back to myopia management. And I was really pleased with the announcement of Sarah Michelle Gellar as their spokesperson, because I'm thinking to myself, all right, who is my target demographic? And I would say that a mom, maybe 30 to 45-year-old mom, is a pretty good target demographic. And I think women in that age group probably know who Sarah Michelle Gellar is. They probably watched Buffy the Vampire Slayer. Paul, you were not Buffy's target audience. But I honestly don't watch a whole lot of TV, and I didn't have cable growing up. And so the fact that I knew who Sarah Michelle Gellar was, I think says that there's probably a lot of people who know who she is. So I think it's a fantastic choice. And I do think we need to put pressure from the public on this topic so that more doctors will be convinced that it's worthy of their time and effort. Gotcha.
Yeah, I mean, when I think of the video that Coopervision released, and I'll link to it in the show notes for the episode, and Sarah Michelle Gellar mentions the role that myopia has had in the effect of her husband and her family. And I think that's exactly the kind of message that you need to put forward. And, with no offense to Sarah Michelle Gellar, like when you think of like who you would want to talk about myopia control, like we're kind of at a place where it's like almost anyone will do, and Jonathan, like, would you agree with that? That as long as it's not like, it's not, as long as it's somebody that people recognize, like any kind of attention that we can put on this is a valuable effort.
Yeah, absolutely. I mean, Paul brought up a good point. What does the ideal representative look like or sound like? And there, because this is such a new topic to really a majority of the public out there, no one has any preconceived notions about what to expect when they hear it coming from a spokesperson. So I think it's a bold first step. Maybe down the road, I envision it expanding to a team of representatives, a team of celebrities that all support this or endorse this myopia control opportunity. And I don't know, maybe it turns into a movement down the road. Maybe this is the start of a myopia control movement that would parallel the Think About Your Eyes movement that you saw all the commercials for. I don't, whether or not she's the right person, I just think it's an important first step, and it can only be positive.
Yeah, I agree. It reminds me, kind of like hearing you say that reminds me of the early days of the Academy when we were the Orthokeratology Academy of America. And this was like really early days, like I want to say 2006. And we were trying to come up with some sort of media strategy. And we had gotten approached by somebody who claimed to represent a group of celebrities that would, for a price, they would all endorse, your product or service or whatever the case may be. And they said they were really interested in what, Ortho-K, and they had done a little bit of research. And after we couldn't do anything with it because we couldn't afford it. It was a bunch of celebrities that eventually, after we looked into it, ended up being like Vern Troyer and William Shatner. And I think Mr. T was on that list, although maybe I'm misremembering it. But I can't verify that these people were actually involved in this. But after we did some research, we were like, this is a conglomerate of actors or celebrities or personalities that are willing to lend their name to it. And when I began like visualizing, like what would it look like to have like Captain Kirk and Mini-Me and Mr. T talk about myopia control, I was like, I don't know if that's exactly what we want to put forward as far as the image. Like if you had to think of like a dream team of personalities and celebrities to talk about this, like I would much rather have somebody like Sarah Michelle Gellar, who I think, people do respect, and she's had the kind of career that isn't a gimmick, and she has a credible place, especially in the geek community, which is how I'm familiar with her as far as Buffy is concerned and whatnot, even though I didn't watch that show, but I definitely heard a lot about it from my friends that I should be watching that show. So I guess my question is, what can we do? Like, where do we want this to go as the next step? Like, what's the ideal situation? Paul, you're the president of the Academy. If we had that opportunity today, because we're a nonprofit organization, if we had that opportunity, what should happen next?
The opportunity being if we had a celebrity spokesperson for what we're trying to accomplish.
Yeah, if Sarah Michelle Gellar is going to kick us off with Coopervision, where do we see this going? Like, what's the next step?
Well, I don't know. It's hard to say because it's new. It's we haven't really experienced it before. But it's all about awareness, right? So it's awareness to the parents, it's awareness to the patients, but it's awareness to the public in general that eye care matters, And so, even if you take myopia off the table for a minute, it's like people just don't know that even you can get a checkup even if your vision's not blurry. And the earlier, so my goal would be to try to utilize a spokesperson, not just to manage myopia, but to get kids in at an early enough age, because we can see the signs. When you can get the 6 or 7 year old that has not yet become a myope, that's the time to start myopia control, because we know that that's the time to get the kids outside. and the studies have shown that, getting the kids outside after the myopia starts is not as effective as getting them outside before. So in addition to the general awareness of myopia, I think a general awareness of get your kids' eyes checked by the time they're 4 or 5 years old is probably like #1 priority in my mind.
Gotcha. All right.
I would agree with that.
Okay.
Does anybody know, I don't know off the top of my head, how many states now require vision exams prior to kindergarten?
I don't think it's very many. I can tell you that. I don't think it's many.
I know Pennsylvania does not. Yeah.
Okay, Nebraska does now. And I agree. I think it's really important to get these kids in. And I will just plug a little bit for measuring axial length because I know some of you know I'm very adamantly for that. And so one thing that I do in my practice is when I get these kids in for their very first eye exam, if we can get an autorefraction on them, most likely we can get an axial length measurement because it's that easy if you have the right equipment. And so I use that, I put that in my toolbox to say, hey, wow, look at that, we've got a baseline, and oh, maybe this kid isn't as hyperopic as we would expect for this age. Boy, they're sure at risk for, becoming nearsighted as a young age. And that's a fantastic conversation to start having with the parents because you're planting all these seeds. So then a year from now or 2 years from now, when they do transition into myopia and you're trying to talk to them about myopia control or myopia management, it's no longer a new idea to them.
Well put.